From labs to clinics to hospitals, how does your medical data stay in sync? Today we're diving deep into healthcare data interoperability. Imagine this. You go to a clinic, get a lab test at another facility, and later visit a hospital, and each of these places has immediate access to your up-to-date medical history. This seamless flow of information doesn't just happen on its own, it's all thanks to healthcare data interoperability. But what does that actually mean? So how does healthcare data interoperability actually work? It all comes down to a few key principles, including interoperability and conformance. Let's break down what these terms mean in healthcare. First, interoperability is the ability of different healthcare systems and applications to exchange and make use of information. But it's not enough to just send data back and forth. It has to be usable and meaningful. That's where conformance comes in. Conformance is essentially a way to ensure that data meets certain standards so it can be correctly understood across different platforms. To enable effective data exchange, healthcare uses various standards that define the rules of the road for data. Some of the most common include HL7v2.x, HL7v3 and CDA, FHIR, CTS2, DICOM, EDIFACT and EBXML. But why so many? Each standard has strengths for specific types of data and scenarios. HL7v2.x- this is one of the oldest and most widely used standards. It's great for basic messaging between systems like sending lab orders or sharing test results. But it's not as flexible for more complex data structures, which is where newer standards like FHIR come in. HL7v3 and CDA, designed to be more structured, HL7v3 and the Clinical Document Architecture, CDA, allow richer data sharing. They're widely used for sharing documents like patient summaries, but can be complicated to implement. FHIR Fast Healthcare Interoperability Resources, or FHIR, is newer and aims to address the limitations of older standards. It's built with web technology and is highly adaptable, making it a favorite for modern applications, especially for patient-facing systems. CTS2. This standard supports terminology and vocabulary services, ensuring consistency in how medical terms are used across different systems. DICOM. If you've ever had a scan or X-ray, you've benefited from DICOM, a standard that allows for the exchange of medical images. EDIFACT and EBXML, used for administrative and financial data exchanges, these standards are particularly valuable in areas like billing and insurance claims. In short, different standards have different strengths, which is why some exchanges are chosen over others. FHIR, for instance, may be preferred for its flexibility and ease of use in new applications, whereas HL7v2.x remains popular in established healthcare systems due to its simplicity and widespread adoption. Let's dive deeper into conformance testing. At its core, conformance testing is about ensuring that healthcare applications and systems adhere strictly to agreed-upon data standards like HL7, FHIR, or DICOM. But what does that actually look like in practice? Conformance testing is a detailed multi-step process. It usually starts with defining specific requirements based on the chosen data standard. These requirements are then tested to verify if a system can both send and receive information accurately and in the correct format. For instance, if a system says it's FHIR compatible, conformance testing will assess if it truly supports all necessary FHIR functions, like retrieving patient records or sharing lab results seamlessly. Testing goes beyond just sending a message. It's about validating that the message structure, data elements, and terminologies align perfectly with the standard's rules. For example, an HL7 message has specific segments and fields, each with expected formats and meanings. Conformance testing checks if every part of the message, from patient IDs to test results, is formatted correctly to prevent misinterpretation. Conformance testing generally includes 3 levels to ensure comprehensive coverage: syntax, semantics, and workflow testing. This level checks the basic structure of data messages to ensure they conform to the specific format and layout rules defined by the standard. It's like grammar checking for data, ensuring the structure is correct. This ensures the data's meaning is preserved across systems. For instance, if one system categorizes a diagnosis as type 2 diabetes, it must translate accurately in other systems, preventing any misinterpretation. This level ensures that data is accurately shared throughout different stages of healthcare processes, areas, like from lab tests to diagnostics and treatment plans, supporting an uninterrupted flow of information. The benefits of conformance testing extend to healthcare professionals, developers, and patients alike. For healthcare professionals, conformance testing means reliable, timely access to patient data, which translates to better clinical decisions. It helps create a safety net against potential data misinterpretations that could lead to incorrect diagnoses or treatments. Developers use conformance testing to ensure their software works seamlessly within the complex ecosystem of healthcare IT systems. For instance, an EHR developer would need to confirm that their system can accurately interpret and process data from external sources without issues. For patients, conformance testing offers peace of mind. With data flowing accurately and securely across systems, patients experience more coordinated care and fewer errors, knowing their information is always up to date and accessible. Despite its importance, conformance testing can be challenging. Data standards in healthcare are complex and frequently updated, meaning systems must be tested and retested to keep up. Additionally, implementing comprehensive testing often requires specialized tools and expertise to verify all aspects of data exchange. Because of these challenges, institutions like NIST and the Office of the National Coordinator for Health Information Technology, ONC, develop rigorous testing protocols and tools to help organizations maintain high conformance standards. These protocols provide testing scenarios and benchmarks to verify that healthcare applications can operate effectively in a real-world environment. Ultimately, rigorous conformance testing is about ensuring that when healthcare providers hit send on patient data, the information is accurate, secure, and interoperable. This meticulous process strengthens the entire healthcare ecosystem by enabling seamless, reliable data exchange that supports better outcomes. So, what does all of this mean for patients, healthcare professionals, and the future of healthcare? At its core, interoperability and effective data exchange mean better, safer, and faster care. When healthcare systems can communicate seamlessly, patients don't have to worry about transferring records, filling in the gaps in their medical history, or redoing tests simply because their information couldn't be shared. For healthcare providers, it enables real-time access to the most accurate data, helping them make informed decisions quickly. It also reduces redundancies like repeated tests or unnecessary procedures, saving both time and resources. This interconnected data flow supports a more efficient healthcare system where providers can focus more on patients and less on paperwork. Looking to the future, interoperability continues to evolve. New data standards are on the horizon, and current standards are being updated to meet the needs of an increasingly digital healthcare landscape. FHIR, for instance, is continually refined to be more flexible and patient-centered, especially with its adaptability for mobile apps and patient engagement tools. Advanced interoperability will make it easier for patients to access and manage their health records through digital tools, creating a truly integrated experience. And conformance testing will remain at the forefront, ensuring that as technology advances, we maintain reliability, accuracy, and security in data exchange. Initiatives led by organizations like NIST and ONC will play a crucial role in setting benchmarks for these technologies, enabling developers, healthcare providers, and patients to trust that their data flows safely and accurately. In conclusion, healthcare data interoperability and conformance testing represent the foundation of a modern connected healthcare system. It's about making healthcare data work better for everyone, delivering safer care, smarter technology, and ultimately a more responsive, patient-centered healthcare experience. As these technologies continue to grow, the future of healthcare looks not only more efficient, but also more compassionate, with patients at the heart of every innovation.